being here so early in the morning. I'm Lisa Strandberg, and as Community Engagement Director here at Pillars, I'm tickled to share my second cup of coffee this morning with all of you at Conversations Over Coffee. Conversations is a bi-monthly opportunity to catch up with Pillars in a casual setting. We'd love to share this conversation more broadly, so we do intend to record it. If you would rather not be visible in that recording, feel free to stop your video so that you won't be seen. If you'd rather your name not be seen, you can rename yourself by clicking on those three blue dots in the upper right-hand corner of your picture so that you're totally anonymous. In a perfect world, we'd be having this conversation across the table from each other in our community room at 609 East Hancock Street in Appleton. But this is an imperfect world, so Zoom will have to do. But I think it's kind of fortunate given the weather forecast that most of us are snug at home this morning. So before we dive into our update on how COVID-19 is affecting our clients, I'd like to remind you what it is that Pillars is all about. We, in partnership with all of you, provide shelter, support, and solutions to address the housing needs in our community. We innovate and collaborate to ensure that episodes of homelessness are rare and brief, and that everyone has a place to call home. We'd like to give you a sense of who is in the room with you this morning. So I am going to call up a poll that will give you a chance to let us know. And I'm gonna stop show. Nope, I can do it right live in the poll. Here we go. You should be seeing on screen a question about the role you play on the Pillars team. You might need to scroll to see all the options, but please respond with the option that fits you best. And then once I see the responses stop coming in, I'll be sharing the results so you can see who else is here. Looks like things have slowed down. And I'm gonna go ahead and stop the poll there and show you who we've got in the room. So a good mix of volunteers, donors, funders, community partners, board members, employees, and then folks who are just curious. And we're glad you're here too, because we'd like for you to get to know us better, and we'd like to get to know you better too. No matter what brings you here, we want to thank you for caring how things are going for our clients as they, like you, make their way through the pandemic. So we have 4 leaders here from Pillars with us today to share our COVID-19 resilience story with you. And I'm going to ask that they each introduce themselves as I call upon them, starting with our fearless leader, Joe.
Good morning, everybody. Thanks for being with us. I'm Joe Mothi, Executive Director of Pillars. I guess to wrap it up, I'm the one who has the privilege of leading this team. I get to share the joys of what we do and related to that, ask you for help once in a while. Today will be mostly about joys, so thanks for being here.
Great. Christine?
Hi, I don't know if you guys can see me. I can't see myself, so I don't think my camera is working. Classic move. So I am the shelter manager of the Pillars Adult and Family Shelter, and very excited to be here with you guys today.
Oops, Betsy?
Hi everyone, I'm Betsy Barnes, and I am the Resource Center manager. So I'm glad to be here as well.
And Tara.
Good morning, everyone. I am Tara Prawl. I'm the Supportive Services Director. So I work with our supportive housing programs, folks that have exited a shelter or another place not intended for human habitation and are now in supportive housing. Good morning and welcome.
Thanks, y'all. I'm really lucky to get to work with all these folks every day. We have a lot of rich ground to cover this morning, starting with Joe's take on a remarkable December. Then Betsy and Christine will share updates on rapid testing and vaccination in our shelters and our resource center. And then to finish up, Tara is going to give us a pillar's eye view of the eviction moratorium. Our intent is to leave 15 minutes at the end so that all of you can ask the questions that you have burning. I'll be gently and firmly coaxing my colleagues along to make sure we get there so that you have plenty of time to get your questions answered. You're welcome to post any questions you have in the chat as we go, and we'll either field them along the way or answer them in the Q&A at the end. And with that, I'm going to pass the reins and the remote control, to, I hope, to Joe so that he can share his part of the story.
Great, thank you, Lisa. And let's see if I can.
I'm getting there, Joe.
Okay.
There you are.
Okay. Do I have control of the PowerPoint then?
I believe you do.
And then.
Lower left. There's arrows in the lower left you need to advance with.
Oh, thank you. Okay.
Yeah.
Yeah, and Lisa, keep me honest on time. I don't get a chance to talk like this as much anymore. And I realized after the last couple of days, I had a couple opportunities. One, how much I missed it. And two, how much I have to say. So I sometimes tend to ramble on a little bit. So I'll try and keep it pretty tight. But my topic here, where's my little button, Lisa? There it is. There we go. So it's a December to remember, and we're a little bit out of December, but I think that's a good topic for us. You know, it's always good to look back a little bit and reflect and see where you were. It's always instructive, and you can see things a little bit more clearly than when you're in the pressure and the fog of the moment. So what we realized looking back on December was it was quite a month in a number of respects. But it really was, as much as anything, I think it was a microcosm of the entire pandemic year as well. And I'll kind of walk you through that, of what we experienced in December and how that relates to the larger story of COVID-19 for us and in our community. So the three things to cover is kind of what we've always talked about. You know, from the very first, back in March of last year, we said, day one, our mantra is do whatever it takes to continue delivering on our mission. We knew that was important for our clients. We knew it was important for the community. You know, and as we saw everything else close down, everything closed down in the world that our clients live in, with the library closed and the transit center closed and businesses closed. You know, it's many times, right? It's us and Denny's are the ones who are open 24/7. And I think we beat Denny's over this last year, right? So that was always our focus, is make sure that we can serve our clients, make sure we can serve our community. Of course, the way to do that, then the first place you start worrying is, what about our team? That, as it says, a team is our key to this life-changing, life-preserving service that we have. So that has been our constant, probably biggest worry over the last year. Can we continue to provide services? And then we make no mistake, Pillars exist because of the goodwill of this community, and we exist to serve this community in the way the community wants. And that means this is a community that cares about the citizens here, cares about people who need a little extra help. And we know that we exist exactly in that line of sight. So, so let's take a look then at, in each of these areas, what December looked like for us. I should have practiced on my little arrows. So there's a couple of things here. I'll point it out. The hotel utilization, that's a little bit of our temperature check. So to maybe use a COVID analogy, our temperature check is what's happening at the hotel. Now, quick recap on that. And what's not on this chart is what happened in April, May, and June. When COVID was first hitting, there were a lot of questions, and some of you might have heard me say, our shelters are really designed well to serve a lot of people efficiently. They are not designed well to give people a lot of social distance, new term that we came on us in 2020. So we pivoted and moved all of our single people to the hotel for those 3 months. And if we put that on this chart, you would see our number of people or number of bed nights per month well over 2,000. So we didn't want to dwarf this. And then in July, we moved back into shelter. We understood things more and thought we could do that. So that what I mean by temperature check is when things get dynamic at the shelter, we continue to use a local hotel for isolation and quarantine and overflow and to do what we can. And July and August, we thought we got this thing licked, right? We were able to get back in shelter and use our facilities there. And then it started peaking up in September, October, November. And you can see in December, it was a December to remember for us. So we had 48 clients at some point. We had 48 clients at some point at the hotel for a little over 350 bed nights. And as you can imagine, that starts to stretch things in a lot of ways. So that stretches, it stretches our staff because we're effectively operating a third shelter site and providing meals and getting people in and out and checking in. It stretches our clients because as much as you want to think, well, how nice is it to get a hotel room and cable TV? When you're there, we're also saying you're in quarantine or isolation. So that is intended to be in your room away from everybody else. And that's not easy. That's not easy for a lot of people. It's not easy if you have mental health issues, and it's not easy if you're used to moving around a lot during the day. So that was the stress for us. And it was a stress on the community as well, because one of the things that happens is it's a lot more dynamic at the hotel, and the community response, other people experiencing homelessness, not necessarily under our care, are starting to go there, and we're starting to try to get in and find places to sleep and so on. So we added a security presence to make sure that we had better eyes and control on what was happening, and making sure that in fact that isolation and quarantine was being followed and respected, and need to add some staff to be able to support that. So if that's our temperature check, our temperature spiked in December and really stretched us in a lot of ways. One thing, total tangent right here, that third bullet point about our ThedaCare inpatient behavioral health bridge. I'm really proud of our team because despite all of this and despite being pulled and stretched, we're still looking for ways to improve service. So we entered into a new program, a new agreement with ThedaCare as their behavioral health, inpatient behavioral health was running full, and they want to be able to make sure that they're doing that well and serving the community as much as possible. They have people that they need to discharge to free up beds who don't have a place to go. So we put a program in place where we communicate and we can bridge people out of the hospital and into shelter or into the hotel as a bridge to shelter. And that's a separate conversation over coffee in terms of some of the tremendous success we've had with that. So that's a little bit of kind of a snapshot of what happened. And with that, then let's talk about from a staffing. So we have to keep that going. And you can see here, and Carlin is our poster child for positive attitude despite adversity, with a smile behind the mask and a thumbs up. You can see here, right, we're not any different than anybody else. So since April, we've had 78 incidents that could be a positive case of COVID or an exposure requiring isolation and quarantine. We've had about a third of our employees have been infected with COVID, which, no surprise, that lines up. Maybe the surprise is it's not higher given our environment, but it lines up with national statistics. And then in December alone, no surprise, as we see a spike in the need for hotel services, some of that gets reflected in our staff. So in December, we had 21 staff incidents, 8 positive cases. So then you're wondering, so how do we do this? Because I'll say, as that underlying worry for me has always been, if we're going to continue our mission, do we have the staff to do it? Well, here's a little bit of our plan of how we do that. Here's 3 steps to our how do we manage staffing. And the first one is, where we can, we flex staff between sites. That is clearly a benefit of Pillars versus running 3 independent agencies just 2.5 years ago. So so we now have staff that can work at multiple sites, and we flex back and forth to be able to do it. That's our first, when we're getting short, how do we do it? We flex around. The second thing we do is we have our daytime resource center that Betsy's managing. That's our first fallback. So we had a number of times in October and November and December where when we start getting short on staff and we start getting more COVID exposure, we'll close the resource center. We'll open the adult shelter on College Avenue in a 24-hour capacity instead of an overnight capacity. We'll flex our staff there. So it really is a chance to make sure that we continue to have a place to go. Again, when everybody else is closed, we stay open. So we flex our resource center staff to the adult shelter. We flex our operating model, and that's our second fallback. Our third move then is to use an emergency staffing plan, which is, and we worked with City of Appleton Public Health to have this ESP, which is essentially working quarantine. So if we have a staff member who was exposed but not symptomatic for COVID, in a pinch when we can't staff another way, we'll put all the precautions in place about extra PPE and distance and communication, but we'll work through, and we've had to do that just a couple of times. If you're wondering what steps 4 and 5 are on this step, we haven't got to step 4, so we didn't put it on there. Step 4 is we start putting the call out to kind of broad pillars agency, and we pull people from roles that are not direct service roles. And step 5 is the one we don't want to talk about, which is we start looking at shutting down programs and putting out a call to the community because we can no longer support our operations. It's not that we haven't talked about that and haven't worried about that a little bit. Thankfully, we've not got to step 4 or 5 in our staffing plan. So that's taking care of the clients, making sure our staff is available to do that. And then the last piece of that is community support. And before we look at that, the part of the microcosm of December from a community support standpoint for us is what's going to happen. So a lot of questions. And what we knew going into December was that the community throughout the year has been incredibly generous. And when we got into that April and May time when everything was hitting and new, the community reached out to us in a big way to support us. What we didn't know is when December comes, is that still going to be there? Of people who gave to us earlier in the year, was that just an advance of what they might typically do at the end of the year? So we went into December with optimism and high expectations, but we really didn't know what was going to happen. And so I'll show you kind of the December to remember from a community support. And just to show this chart, you can see the green line and the blue line here are 2018 and 2019, and you can see those are pretty steady. This is a day by day. We kind of track how are we doing day by day throughout December, which of course is our big month of giving. And then the orange line on top is 2020. And as you can see, 2 weeks into the month, we were still saying, all right, so what's December going to be? Is it going to be the same as it's been, which we'd be thankful for? Is it going to be more or less? And how's the community going to respond? And then in the last 2 weeks of the month, it really took off. And that was made it's a huge level of support, made a huge difference. And in the end, community giving, and we'll define that as individuals, churches, businesses, civic groups, really came through, and we saw a 50% increase in giving. So what does that do for us? I mean, there's that emotional support of, yeah, Pillars, we're behind you, right? And we want to support you. But that additional giving has allowed us to make tough decisions for us because we don't want to get too far out in front of ourselves financially either. So to allow us to do a bigger winter overflow at the hotel, as I talked about, to allow us to make some staff additions to fill those volunteer gaps we talked about just before we started the formal part of this, and to be able to provide effective beginning of January hazard pay for our frontline workers, because throughout all of this, the frontline workers have been critical and have been in a hazardous environment. The other thing worth noting is it's not just the community. As we know, there's a lot of other support out there, and it's been flexible. So some of the larger community foundations that we've been involved with have been great about giving us flexible funding. There's been government funding that's been available as well. And then we've been doing a little bit of move the pieces around, including we had funding from the community to do something, government funding became available. So we repurposed that and moved the government funding to some things that was intended for, went back to the larger philanthropic community funders and said, can we repurpose this now? And here's our next need. So the community's been great and flexible, and there's been a huge message of, we trust you, and do what you need to. And that's allowed us to be able to respond. And I'm happy to say, I think we're in a good spot now to be able to go forward. So in all of that, I'll wrap up and transition from there. I just can't put enough emphasis on how much this means to us and how important it is to us, and how much this feels like a partnership. And the next thing I'm going to say is by no means a complaint, not at all. But to this day, I still have some wrist problems from signing thank you letters that are the impact of this graph. And I also told at least one person on this call, take this presentation also as my personal apology for the number of emails I didn't get to return in December as well. So I'm using that as a little bit of a pass on keeping up with some other relationships. But with that, so that's a December to remember, which is really a 2020 to remember. And now we'll transition into a couple of current topics for us that you might be interested in of what's coming next. So I will advance, and Betsy's going to talk about our ability now to do rapid testing in-house and how that impacts our operations going forward.
Thanks, Joe. I'm so excited to talk about this rapid testing because it has drastically changed things at Pillars. So you can imagine someone comes to our shelter last night or before we had the rapid testing, which we just implemented last week. It's 10 o'clock, it's cold out, I have nowhere to go. What do we do? Well, first off, do we even have a spot? Even if we had a spot for them, we can't just bring people in. As you know, we have everybody in a huge room, and we can't bring people in who could potentially have COVID. So that is a huge risk. So what we had been doing is we're sending people to the hotel, and Joe talked about this a little bit, which obviously is costly. We got them, so let's get a COVID test, go to the hotel. It took 4 to 7 days to get that COVID test back and then come back. And in the meantime, staff have to check on people, bring meals, bring medications. So we were stretched pretty thin, and it was time consuming and complicating to manage both of those things, and with the wait list as well. So now someone comes in, it's 10 o'clock at night, I have nowhere to go, it's cold outside. Guess what? We have a spot for you. And guess what? We can take a COVID test in 15 minutes. So now we give someone this rapid test. They wait in the lobby for 15 minutes as we get the results. It's negative. We're allowed to let them in and have that spot now. If we don't have room, we would still send them to the hotel and wait until we have a spot open, but we're able to test people immediately. And so this is a huge improvement in our program. We can also do that at the resource center during the day. So when people come into the resource center looking for shelter, instead of the old protocol, which was, well, let's get you a test, a COVID test downtown, and then put you in the hotel and wait till that gets back. Now, again, we can give them the rapid test. Okay, so that's out of the way. They're COVID clear. Now let's find a spot for them and find the best way to support them. So that has been a huge impact, as well as staff. So Joe talked a little bit about all of the staff time. We've all been exposed at one time or another where we're isolated at home. And obviously many of us were sick as well. So now someone comes in and has a little scratchy throat. Before the rapid test, we would all say, go, run, go home. And they would have to stay home they would get tested, stay home for that week until they got the results. And now we can give someone a test immediately. They can wait in the lobby, see how they're feeling. If the test is negative, they can work. So that is a huge relief to us, as well as exposures. We can test people so they still may have to miss a day or two, and we're working with the city on all of the regulations. The health department's helping us. For exposure, you have to wait a certain amount of days and things like that. So there's still a minimal amount of time you may have to miss, but the time that we're cutting off of staff missing is huge. And so as Joe talked about, the front lines have been stretched so thin, and this rapid testing, thank you ThedaCare, who gave us all of these rapid tests. That has been a huge help to us and a huge asset, and we plan to utilize that for the next few months. And we're not sure if we are going to have this until the end of COVID, but for the next few months, we have the access to this, and it's going to greatly impact how we are able to serve people. With that, I'll pass on, but if you have any questions about the rapid test, feel free to shoot me a private message or ask us after. Thanks.
Thanks, Betsy. Next up, we have Christine McCain, and she is our Pillars Adult and Family Shelter Manager. She'll be talking with you about vaccination and what's on the horizon there. Christine, take it away.
Okay. First, I want to thank Mike for trying to help me fix my video, but it's just not working. So thanks for trying. So shelter is congregate living, which has fallen into the 1B phase of the availability for vaccinations, which puts us at March 1st. So Pillars is working with the city and a variety of providers to try and facilitate the vaccination for staff, making sure that we can mitigate that risk factor as soon as possible, and clients as well. So making sure we can try and mitigate that risk factor of COVID, and again, cut down on that staff time, cut down on that exposure to clients and the cost of being at the hotel. Even with the vaccination, we still do plan on following the protocols that we have in place with the mask wearing, the social distancing, and making sure that everyone's sanitizing, washing their hands on a regular basis. Right now, some things as we're in the planning phases of the vaccination is making sure that we're educating staff and clients. Clients especially, there's a lot of distrust in maybe the government or different medical processes. And so really making sure that we're taking the time to help them understand the development of the vaccination and increase their comfortability with receiving the vaccination. Then working through the many barriers that clients and sometimes even staff face to getting the vaccination, which is lack of transportation. Many clients are just relying on public transport to get around. So providing those bus passes or bringing the vaccine where it's available for them on site potentially. Right now, we're also having to work around client schedules. So maybe 50% of the folks at the adult shelter and 80% of the adults at the adult and family shelter are working at any given time with a variety of work schedules, first, second, third shift. So making sure that we're fitting this into when they're available. And then especially for staff, looking at maybe a staggered approach so that we're not having all staff out the following day with a reaction or illness to the vaccine if that were to onset. So with all of this, trying to figure out if we're going to do this on-site at Pillars or have it off-site somewhere that would be accessible for clients and staff alike.
Thanks, Christine. We are going to move on next to Tara, and she will address the eviction moratorium and what we know and what we don't know about that?
Sure. So we have been in a variety of moratoriums since the beginning of COVID, ultimately. So there has been a handful of them that we've been navigating across to identify services that we can provide, services that have been that need to be extended, or additional services that need to be provided, and then the stops on kind of that eviction piece for people who are experiencing the downfalls of COVID, losing their job, their income has been lowered for some reason, being out of work, so they've lost income that way. Currently, we're in a CDC moratorium, which was instituted in September, but has now been since extended through March 31st. And that ultimately means that if somebody is unable to pay their rent, they cannot receive a notice pending they complete a CDC moratorium declaration. And so without the declaration, they're actually still potentially could move forward with an eviction. A landlord could. They have to have that declaration in place. And landlords are still able to issue evictions for things other than rent-based reasons, or can issue a non-renewal. I'm not an expert on moratoriums, but I know a little bit, largely because a lot of our programming plays into moratoriums. And of course, we've been working with landlords on this piece since the beginning of COVID, when moratoriums were first introduced. So like it states in the slides, rent payment is not delayed. It's just relieved, and it's just kind of postponed for now. So the intention is that folks should still be paying their rent as they can. It shouldn't be just I don't have to, so I'm not going to. It's really intended to, if you can't, then there's this opportunity for a little bit of relief, or a little bit of cushion to ensure that you can remain in your unit. There are tenants out there that are definitely delayed on rent because they are presenting for services with Pillars. And unfortunately, for some of our folks that are presenting that are not with Pillars, we actually aren't able to assist them. So as Joe mentioned, we have government funding out there that can, that has been offsetting, and some of that is called prevention funding. And across the state, that has been provided to a lot of agencies. However, folks who they're receiving a 5-day notice, or they're looking at facing eviction, there is a support in place with this moratorium, stating that they can, use this support and remain in their unit. And so there's just, as much as, government funding assists us in a lot of ways, sometimes and I'm grateful for it, because it keeps our team employed, and it keeps people on the ground, and keeps people in houses and provides houses. There's always restrictions. And so one of those limitations says, if somebody has the opportunity to do the CDC moratorium, they need to do it. That's considered a support. We cannot release certain funds to assist. But later on, as this ends, that is where we're going to see folks presenting, and that eligibility requirement will then be ultimately lifted. And there are programs still in our community that can assist with folks that aren't using these specific dollars for it, such as Levin. We have been on pace, as it says, for rent as far as Pillars owned properties and our Pillars tenants. And our stable housing team has worked diligently with keeping folks in their units, setting up payment plans, referring to other resources. There's additional rental assistance coming down the pike soon that'll also funnel through CAP agencies to help catch people up, hopefully, in preparation for when this moratorium ends. And so they could assist now, and landlords can even potentially apply for that assistance too, to get somebody on track. And so that could really, really help folks to avoid that moratorium, or that eviction, when the moratorium does end, if landlords are still willing to move forward and keep them as tenants. We don't know what we're going to see as this ends. Suspicions are we're going to see more people presenting for services, and higher folks needing prevention diversion services and facing eviction. It's of course speculation at this point, but based on the end of past moratoriums, we have seen some movement with that. So there is a good chance. So our diversion team is just kind of bracing for the impact on what that's going to look like, and likely our shelter team as well, in case folks are not presenting for shelter. So I'm happy to take questions, or if there's anything more that you wanted me to cover with that. I will say we are also under an additional moratorium for utilities that's extended through, it's a kind of a typical moratorium for utilities. It started earlier than normal, but our utility moratorium is in place until April 15th. So similar timing to when the CDC moratorium ends, and that could also put people at risk with their housing, because they now might be looking at really high utility bills that they also have to battle along with any past rent that's still due.
I got to leave my cattle prod and taser under my desk. I didn't have to hurry anybody along. That was really great. We've got lots and lots of time for questions, and this is what Conversations is about. It's meant to be a conversation. So I encourage you to, as you are courageous enough, just unmute and ask your question, knowing that we might talk over the top of each other. That's okay. Or if you'd like, if you prefer, just chat your questions in the chat. And if you haven't used the chat before, take your pointer down toward the bottom of your screen, and some little white icons will pop up in the black field there. And there's one labeled chat that looks like a speech balloon. And you click on that, the chat will open up to the right, and you can type in at the bottom any question you might have if you're too shy to ask with your voice. But feel free to unmute and ask questions now.
Hi, this is Dakota with WBAY. Can you all hear me?
Yes.
Okay, perfect. So I'm curious in regards to the vaccinations. I know there's still a lot of planning to be done, but since so many are struggling to either get access to the vaccines or to enough of them, have you all been able to talk with any providers to ensure that around March you all will be getting them?
I'm kicking that one over to Joe. You're up, Joe.
Yep. It's a great question, Dakota. And yes, we've been watching it closely. We've been talking with public health. So right now, I think the quick answer to that is the bottleneck in that process around here is the number of vaccines available. We kind of have the space, the time. We're willing to organize that even for an on-site clinic. We've tentatively have some agreements with some people to administer the vaccines through some pharmacists who are willing to do that on a voluntary basis. So we have everything lined up except the availability of the vaccines, which is restricted right now. So we continue to look at that, hope that that supply chain works its way out. And with, I think, yesterday's announcement of vaccines also being delivered directly to pharmacies, that may open up some options of how we might be able to do that. But our goal, I think the perfect setting for us is to be able to do on-site vaccination clinics at our shelters. And then, as Christine mentioned, we'll figure out how to stagger that for our staff so we don't inadvertently out for the next day, and then we have to get to like step 4 of our fallback plan immediately. So yeah, we don't have an answer right now, but we're working on it.
Okay, and then one other thing in regards to the vaccines, I was wondering if someone could kind of expand on, why clients might be a little distrustful of vaccines.
Christine, do you want to talk about that a little bit more?
Sure. I think there's kind of a general distrust from some people with how quickly the vaccine was put, has come together and been approved. It's just sort of a not uncommon for some people to feel some unease or uncertainty about whether they're ready to receive this vaccination. So just that education piece of, that we all may have had or have educated ourselves, but taking that time to make sure we're explaining that this is safe and it was still research, there were still trials done, and help explain to when we see something like on Facebook where somebody says this person passed away after receiving the vaccination, or they had this reaction after receiving the vaccination, help explain how things have changed and that they are having people wait on site for a period of time after receiving the vaccination to be monitored in case there is an allergic reaction or any of those steps that we can clarify for them.
If I could, it just may throw one more thought into that. Again, remember that a lot of times the population we serve has had a fair amount of government interaction over their years in a variety of ways. And if that hasn't gone smoothly or to their liking, I think there might be a natural distrust of, is this going to be the same as some of the other things I've seen as I've applied for disability benefits or tried to access services in one way or another. So it probably falls a little bit under the shadow of their lived experience as well. So.
Okay.
Just layering on top of that, if I may, we serve a disproportionate number of people of color, and we know too that there is distrust there between people of color historically and the medical community. So.
Okay, and just one more question. Sorry. I just don't know one way or another. Do your clients have access to, the internet or ways to get, good information to be able to research on their own? Because I know a lot of libraries are restricting access and things right now. So is that also kind of an issue as well?
That feels like a Christine and/or Betsy question.
I can take that. Yeah, so folks in shelter have access to Wi-Fi. Each shelter and the resource center has computers that clients can use. So accessing the information isn't necessarily a barrier. I think it's just helping them access the correct information.
Gotcha. Thanks, guys.
All right, I'm going to toss out a comment from a volunteer who said, just wanted to say that I first heard of the rapid testing yesterday while volunteering at the front desk at the shelter. Got to see the process in action, was excited and impressed. So thank you for that. We're excited and impressed as well. Here's a question from Jenny. A few months ago, I heard Karen Harkness, who leads the Community and Economic Development team at the City of Appleton, talk about an extra overflow location in Appleton that would be funded by community development block grant dollars, some of that government funding we were talking about earlier. Did anything ever happen there? Joe, I'm going to toss that one.
Great question, Jenny. In November, the city said that they wanted to open a everyday winter shelter, I'm just going to say not overflow, but a everyday cold weather shelter. And they gave that a good run and looked at putting plans together, and in the end decided that that wasn't feasible. And I think the same things that we had talked about is, do we want to do that? The amount of, to be able to do that on an everyday basis, the amount of staffing is pretty considerable, and consequently then the amount of cost is considerable. So I think maybe late November, they said that they weren't going to do that, and essentially it was too big of an operational task for the city, which isn't core to their mission. And they kind of said, we're better suited to do what we do best, which is to identify, secure, and make funding available. And they would look for the community to do the operational aspects of that, and they support us in that. I think that will be an ongoing discussion about, do we need additional winter capacity? What we're doing right now is, again, as we talked about earlier, is utilizing the local hotel for our cold weather overflow, which is, we've been talking about that a lot lately with the next week of cold weather coming.
Harvey asks, what is Pillar's annual budget? And I can field that one myself. It's just a little over $4 million. And I know Harvey is a former board member of one of our legacy organizations, so he probably has a sense of scale of what that means relative to the budget of the organization he used to serve on the board.
I was one of the founding members of the Housing Partnership Organization. And I don't remember the numbers, but I'm certain that we didn't approach the $2 million mark while I was still on that board. But it's exciting to see how Pillars has filled in and grown over the years. It's terrific. Thank you very much.
Thanks, Harvey, and thanks for setting that up. Those, our three legacy organizations, Fox Valley Warming Shelter, Homeless Connections, formerly Emergency Shelter, and Housing Partnership. I think we've seen a lot of benefits over the last year of having an organization that has got more size and consequently more ability to kind of flex and respond to the needs of the community. And all of those were fortunately well conceived and well run, and putting that together has really benefited our community.
Tara, Christine, to build on that, does either of you have anything to add about sort of handoffs between programs and how that's changed with the merger?
Sure, that has been probably our greatest achievement, I think, between being able to work with each other as a larger supportive services team and have the conversations about warm handoffs and somebody's moving from one location to the next and how can we best serve and support them and maintain that connection. We have, I think we've never had a better relationship in being able to move folks across our system from shelter into housing, from shelter into shelter, from shelter into stable housing, because we can have open conversations and everybody knows that we're received, that it is one service and it is one agency. And so they know that there's going to be this ability to still even go back to the initial services they received and their initial workers and have conversations with them. And, you know, we've seen shelter workers or shelter case managers come in on our home visits when they're in supportive housing now, and that's really neat. And supportive services workers go over to the RC or to the shelters and have conversations with them there and complete their intake. So that has been fantastic to see and to watch and to be a part of. And truly, you know, the intention of the merger was to streamline services, and we have made leaps and bounds in that area to ensure that the merge was intentional and helpful and better for the folks that we're serving.
And since we're having a casual cup of coffee, you're insiders. RC means Resource Center in Pillars lingo. So
yes, thank you.
No problem. No problem.
I was going to add that, Lisa, that the RC is our lingo for Resource Center, but the communication between sites has been helpful here as well. So oftentimes we'll see an email come out, hey, I'm looking for this person. So then when they come into the RC, we can give that staff person a call and say, hey, he's actually here. Why don't you come on over? And so it helps us to work together with that, which before that was harder to do with HIPAA rules.
Betsy, while we've got you talking, do you want to share just a little bit about what happens at the Resource Center? What goes on there? I don't know if everyone here is familiar.
Sure. The Resource Center, we are open during the day hours, Monday through Friday, and it was originally created as a place to go for folks who didn't have a place to go during the day. We of course encourage all of the clients we work with to go out and look for a job or get the medications they need or work on some of the things, the barriers that they have, but a lot of people struggled with that and need help. So this is a way for us to meet them where they are. So you come into the Resource Center, it's warm, you get a cup of coffee, you sit down, and guess what? We've got job training today, or we have staff ready to help with resumes or with your credit or apply for housing, or someone doesn't have a place, they're shelterless, and our outreach team finds them sleeping under a bridge or in one of the, we call them the tubes, but the walkways that go over the College Avenue from the hotel to the, so we find people and then we say, hey, come on over to the Resource Center during the day. And then they come in and they're more trusting with that, and we're able to work with people on getting them into the system so that getting them the help that they need. With COVID, we aren't able to have as many outside resources that we previously did, just because a lot of other agencies have canceled on some of that for now. But generally speaking, then different agencies from the community come in. Goodwill still comes in now. FISC, other agencies come in to present to our clients and help in other ways. We also have counseling that comes in every Wednesday. and that's free for our clients if they want to talk to someone if they're struggling. We also have AODA services. So we have, which is alcohol and drug abuse. So when people are struggling with that, they can come in and talk to someone who specializes just in that. So we're really excited about all the different things that we can offer. One more thing we can offer, well, there's many more, but that I forgot to mention was our SOAR case manager. And SOAR helps people sign up for Social Security benefits. And that is a huge hurdle for folks. I'm not sure if you know what if you think your taxes are hard to do, which maybe you don't, but this is about 100 times worse than that. And there's tons of paperwork and phone calls and interviews, and a lot of the folks we're working with really struggle with that. So we have someone who is trained in that and specializes in that and works to get them the income that they desperately need to move on. So those are some of the things we do at the Resource Center. So come and check it out sometime.
Thanks so much, Betsy. We do need volunteers at the Resource Center. So give Tony a call if you're interested in that. We have a question. Would a doctor come to the shelter and give a talk to help with hesitation around the vaccine? And we had the next best thing to a doctor. Joe, do you want to talk about that a little bit?
Sure. So we just had a all staff meeting this week, and we did two things for education. Our president of our board of directors, Tom Beezer, is also the chief nursing officer at Holy Family Memorial Hospital in Manitowoc. So he gave us his perspective, kind of from a clinical perspective, as well as actually sitting right next door to the clinic at the hospital where all of those vaccinations are done. So he did that. And then we also brought in somebody who by profession is a midwife, and by disposition is a little leery of vaccinations or cautious about vaccinations in general, and making sure that she kind of does her own personal research on it. So she shared her own learnings and journey and how she made her decisions on getting the vaccine and how that kind of impacted her thinking and her ability to do her job. So I think that was good for our staff. And then we'll be looking over the next month for ways that we can then educate our clients as well. But the first step to that is making sure that our staff is knowledgeable and educated, and then we'll be able to pass that information on.
We are, for the sake of clients, also leveraging materials that Partnership Community Health Center already has put together. So that's been a great collaboration with them as well. Kim asks, beyond rapid testing and vaccinations, where is the greatest need for volunteers or donations as the weather gets colder?
I can hop in. Yeah, so as far as volunteers go, every single opportunity is a good one for anyone looking to get involved. However, right now, because of the staffing issues that we're seeing and just the busyness that we're seeing with folks coming in looking for resources, anything that can supplement the staff. So you're looking at front desk opportunities and especially dinner service in the evening. Those are tasks that if we don't have volunteers coming in to serve, the staff actually has to take on those opportunities and those roles, meaning that takes them away from their normal duties of doing intakes for a new family, answering questions when clients come in. Instead, the staff is off covering shifts that normally would be covered by volunteers. So anything that can supplement the staff is huge. For me, I love when we have dinner volunteers. It certainly helps me sleep better at night when we have folks in to serve dinner, because I know that takes 4 to 5 individuals. And when we have 2 people on staff, it's very difficult for them to come in and serve dinner when there isn't a volunteer and there's other things going on. So dinner is definitely a huge one. I know we have a few dinner folks in the chat right now and some front desk folks as well, along with other volunteers too behind the scenes. And they're all important, but right now definitely those supplemental roles. So feel free to reach out to me whenever you get a chance. If you're looking to become more involved or want to get involved to start off, I'd love to talk with you more and get you started here at the Pillars team.
Thanks,
and a little
Tony.
outside of the box, if you know any landlords who want to work with folks and give people an opportunity who are looking for a rental and maybe have a challenging rental history or are lower income, spread the word, Because Pillars is always making that connection for supportive housing programs through our stable housing and through our shelters.
Betsy, do you want to talk about gloves, hand warmers? I think we're doing okay with hand warmers after this week's response, but.
I was thinking about butting in, but I didn't know if I could. We are out of gloves at the resource center, and that's a tough thing. We had a lot at Christmas time, and we've gone through them all, and sometimes people lose them, or I'm not sure what happens, but we are always giving out gloves. And of course, with this next stretch coming up, we're very concerned. We did get a big donation of hand warmers and toe warmers, and we hand those out daily as well. But gloves, we have 0 pair right now. So if anyone's looking for a great way to donate, that would be a huge help to us over this next cold stretch. Thank you. Thanks, Lisa.
Betsy, what kind of gloves? Be specific.
Winter gloves, sorry, warm gloves, usually men's. We have more men than women, and women can wear bigger gloves. So if we had too many men, that would be great, men gloves. So warm winter gloves.
Insulated, waterproof, right? Not handmade. Not handmade.
Oh, that's what, yeah. So some of the really cool looking knit handmade ones aren't as warm sometimes. So we love the insulated gloves that you purchase.
If anyone wants to donate those, the best place to do that is in the drop box at the adult shelter. It's always there, and you can anytime, day or night, drop anything off. That's 1928 West College Avenue. Let's see. What have I missed? A comment from someone at Outagamie County. Thrilled to hear that we have rapid testing in place. We are thrilled too. So thanks for that. We talked about greatest needs. There was a question. Oh, where's the RC located? Betsy, where is the RC?
We're 129 South Mason Street. We're connected to St. Matthew's Church. We're in the back, so we're right off of the Mason Street parking lot. You'll see a pillar sign. Come on around, and that's where we are. So Mason and Lawrence is where St. Matthew's is, and Lawrence is 1 block south of College.
Quick question about, this is private, but I'm gonna put it out there. We do have some wish lists online. So if you are still holed up at home waiting for your vaccine and you want to contribute, you can get on your computer. You can go to pillarsinc.org and find wish lists online from Amazon and Target, and you can order and have those items shipped directly to Pillars. So we try to keep those updated on a monthly basis for what we need. And that way you know you're meeting current needs. I think that is where the drop box is at the adult shelter, Pillars Adult Shelter, tucked in behind St. Vincent de Paul, 1928 West College Avenue. So you have to drive along to the left side of St. Vincent de Paul through a little short cyclone fence and back to the shelter, and there's a big drop box right outside the entrance. We are at 8:29. My goodness, we've done it. Thanks so much for your interest in what we do, and thanks so much for your support of what we do. As Joe said, we cannot do this without community support in all its forms: volunteerism, partnership, financial support, et cetera, et cetera, et cetera. So thanks for being here this morning. We will put the recording online. If you want to share it with anybody, we're happy to have you do that. And come on back. Then we have, oh gosh, hang on, don't leave. I've got to share our last slide here. We want you to follow us on social media. We've got, here we go. I promise I won't keep you long. We've got all kinds of interesting things happening on social media. That's where we'll keep you up to date on what we need. That's where we'll keep you up to date on who we're serving and how many folks we're serving and all the cool stuff that's happening here. We also want to bring to your attention at the bottom of the screen, Tuesday, March 30th, our report to the community, which will be a look at the year behind us and probably the year ahead of us, and how things are going for Pillars more broadly than this close look at COVID today. So we have registration up on the website right now. You can go to pillarsinc.org, events, report to the community. There's a simple registration form. It'll take you 20 seconds to register. You can come on back in a couple of months and visit with us again. Thanks so much, everybody. So glad you could make it, and feel free to reach out to me or Joe or any of the other leaders, Tony, about volunteerism. We'd be happy to chat with you more.